This is the first of two videos on chronic diarrhea and will discuss causes. This video will discuss the causes of chronic diarrhea in adults. Normally, if someone is suffering from diarrhea, it usually stops after a few days. However, sometimes the diarrhea doesn't stop and can go on for weeks. Chronic diarrhea is generally defined as loose stools with an increase in bowel frequency for a period of 4 weeks or longer. This usually means 3 or more loose stools in a day. There may be other symptoms like abdominal cramps, bloating, and nausea. The two commonest causes of chronic diarrhea are the irritable bowel syndrome and food intolerance, which has been discussed in detail in another video. Irritable bowel syndrome is a functional disorder characterized by chronic abdominal pain and altered bowel habit, which can include diarrhea. Functional means that it is a problem with the movement of the intestine rather than any damage to the tissues of the digestive system. Investigations done will be normal, showing that there is no underlying damage to the organs. It is estimated that between 5 to 10% of the population suffers from the irritable bowel syndrome. Another important cause of chronic diarrhea is food map intolerance. It can cause diarrhea, bloating, and gas. Food map intolerance is probably the most common cause of diarrhea, bloating, and gas. Food map are carbohydrates in certain foods which cannot be digested because of insufficient enzymes in the small intestine. Food map is the abbreviation for fermentable oligosaccharides, disaccharides, monosaccharides, and polyols. Lactose intolerance is a type of food map. Lactose is a large carbohydrate and is a food map. In the small intestine, there is insufficient lactase enzyme in lactose intolerance. As a result, the big lactose carbohydrate cannot be broken down into simple sugars. Only simple sugars like glucose and galactose can be absorbed by the small intestine. So this large carbohydrate, lactose, then goes into the large intestine. Bacteria in the large intestine ferment or break down the lactose into various substances, including carbon dioxide. The carbon dioxide causes the gas, bloating, and abdominal pain. The lactose that is in the large intestine absorbs water, causing diarrhea. So the basic problem in food map is insufficient enzymes like lactase and many other enzymes that digest the other food map foods. Another cause of chronic diarrhea is bile acid malabsorption, or BAM in short form. It is a common condition where bile that is produced by the liver irritates the large intestine, causing diarrhea. Bile acid malabsorption, or BAM, where bile acid that is produced by the liver is stored in the gallbladder and travels to the last part of the small intestine called the terminal ileum. Normally, the bile acid is absorbed by the terminal ileum and goes back to the liver. Normally, 97% of the bile acid is absorbed back into the body and only 3% normally goes to the large intestine where it is excreted. There are two reasons why bile acid malabsorption happens. Firstly, when there is too much bile produced by the liver. This overwhelms the capacity of the terminal ileum to absorb the bile acid. Another reason is when bile acid cannot be absorbed by the terminal ileum due to damage to the terminal ileum. The bile acid that is not absorbed then travels to the large intestine where it irritates the lining, causing diarrhea. So instead of only 3% of bile acid being in the large intestines in normal people, there could be 20, 30, 40, 50% of bile acid in the large intestine. Too much of bile acid irritates the large intestine. Studies have shown that about 1/3 of patients with the irritable bowel syndrome presenting with diarrhea suffer from bile acid malabsorption. Similarly, 1/3 of patients with another condition called microscopic colitis also suffer from this condition. This condition also affects about 10% of patients following removal of the gallbladder. It is believed that too much bile enters the intestine after gallbladder removal, causing the diarrhea. Another condition that can cause chronic diarrhea is inflammatory bowel disease, where there is chronic inflammation of the intestines due to a hyperactive immune system. There are two types of inflammatory bowel disease: ulcerative colitis and Crohn's disease. This picture shows a patient with ulcerative colitis with chronic inflammation of the large intestine. Infection by parasites and bacteria is another cause of chronic diarrhea. This picture shows two different kinds of parasites which are common. One is called E. histolytica. You can see the parasites in a stool sample in these pictures. Another is called Giardia lamblia. You can see the parasites in this picture. So can some bacteria cause chronic diarrhea like Campylobacter, Clostridium difficile, Salmonella, and Shigella. Microscopic colitis is where there is mild or subtle inflammation of the large intestine. It is tricky to diagnose this condition as the colon looks normal during colonoscopy. The doctor will have to take a piece of colon tissue during the colonoscopy and study it under the microscope before the diagnosis can be made. This picture shows how microscopic colitis looks under a microscope. You can see that there is increased cells in the lining as is marked by the arrow. Usually this condition is caused by medication or a hyperactive immune system. Certain drugs can also cause chronic diarrhea. The common drugs that can cause chronic diarrhea are antibiotics, painkillers, antacids that contain magnesium salts, laxatives, and diabetic medicine, mainly metformin. Antibiotic usage can sometimes be followed by growth of a germ in the intestines. This germ produces a toxin which can cause diarrhea. This toxin can be detected in the stools by special tests. Another cause of chronic diarrhea is celiac disease. It is due to allergy to gluten. Gluten is found in many cereals like wheat, rye, and barley. In celiac disease, there is damage to the lining in the upper small intestine. This is a normal upper small intestine. You can see the finger-like protrusions here called the villi. This is where most of the nutrients from food is absorbed. This is a patient with severe celiac disease. You can see that there is no more villi left here. It's all stunted. This stunting or absence of the villi can affect the absorption of food from the intestine. So these are the common causes of chronic diarrhea. Let's now talk about the less common causes of chronic diarrhea. One is malabsorption. Malabsorption is a failure to digest and absorb food, particularly fat, because of diseases of the digestive organs. The two important organs for digestion and absorption of food are the pancreas, which lies below the stomach, and the small intestine. This happens when the pancreas is not able to produce sufficient enzymes that digest fat and other nutrients. Malabsorption can also happen when the small intestine cannot absorb the food. The food that is not absorbed then travels down the intestine and irritates the colon, causing diarrhea. Often in malabsorption, fat droplets and undigested foods can be seen in the stools. Malabsorption can be caused by diseases of the pancreas, example being chronic inflammation of the pancreas called chronic pancreatitis. Diseases like inflammation of the small intestine can also cause malabsorption. Another less common cause is cancer of the colon, especially in older patients. The less common causes include a hormone condition where the thyroid gland is hyperactive. Excess thyroid hormone increases the movement of intestines. Diabetes mellitus can cause nerve damage to the intestines after many years, and this can result in chronic diarrhea. Alcohol can cause diarrhea by increasing the movement of the intestines. Small intestine bacterial overgrowth, or SIBO, is a condition where bacteria overgrows in the small intestine, and this happens after taking antibiotics. The bacteria in the small intestine ferment carbohydrates, producing gas and diarrhea. Overflow diarrhea occurs in patients who have severe constipation. So these are some of the less common causes of chronic diarrhea.